My name is Dr. Mora, and I'm the head of Health Information, Communicable Diseases and Emergency Response at CARPHA. It's a long holiday. We've been at home, relaxing, with the family and everybody. It's been since Friday, and then we try to find ways to unwind. The COVID has had a very serious impact in the way we work, the way we live, the way we relate with our community, the way we relate with people around us. So it's been quite challenging, having to avoid interaction with friends and having to work remotely most of the time. So I work Monday to Friday, and being the fact that the work ethics and the work protocol has changed, I also find ways to cool off and then strike work-life balance. So sometimes I come out to this swimming pool, I swim, I jog to do exercise, and then I try to meet one or two friends, mindful of the social distancing, of wearing my face mask, and then washing the hands, and also maintaining a very good etiquette, respectful etiquette. The vaccine rollout has started, and I want to encourage everybody to take the vaccine. The issue of hesitancy and the issue of the side effect of the vaccine has been a serious issue, for which we continue to encourage people, the community, the Caribbean people, to take these vaccines, because the benefit still outweighs the risk. Recently some countries and some individuals try to avoid taking up this vaccine because of, especially for the AstraZeneca, where it has been documented that thrombotic events do occur, which has actually not been linked to the vaccination exercise. But, in the abundance of caution, countries have also decided to, pause the rollout of these vaccines. But, WHO and the manufacturer, the regulators continue to reassure the community, reassure the people that the benefits still outweighs the risk, and then continue to encourage all of us to come up to take this vaccine. I've been scheduled to take this vaccine within in next week, and I'm going to take it. Yes, the side effect is expected, even in the other vaccinations that children do take. They normally observe some kind of temperature changes, mild malaise, fever, body weakness, and some kind of transient illness after vaccination. So, which I think is still within that expected range of mild changes that one can notice when you get this vaccination. So it's not different now that we are taking the COVID vaccine. So and that's the situation, and that's the real fact. And I will continue to encourage all of us to wear a mask, social distance, and then abide by the public health advice that has been given by CARPHA and the other regional international health regulators. Thank you. Yeah, staying home and having to work abroad has become part of the reason why somebody has to learn how to cook for himself. So as part and a way of relaxing, I do cook my food, and then today I want to prepare some potatoes and plantain. I hope you join me when I finish. So COVID has made us, taught us how to do everything by ourselves, as in it's part of the protocol not to go to the eateries, and then we've been forced to eat at home and avoid crowds. So going to the eateries is no longer the trending thing. We have to cook our food at home, and we have to eat it. So working from home is a good strategy on how to avoid COVID, and we keep on strategizing at workplace, how to avoid the crowd at work, and then have a limited number of people in the office. So it's been quite challenging and interesting working from home, I've come to develop new skills, of how to work digitally and remotely. And then I think the world has changed. Even when COVID, this pandemic ends, I don't think the world will ever go back to exactly the way it used to be, pre-pandemic. So that is the change that has been brought upon us by COVID, and then we keep on devising ways to live with it and avoid infection. I'm doing most of my work. I work Monday to Fridays. I go to work maybe like 4 times in a week. Other times I'm doing my work from home, and I can basically sign any document. I can do anything, do meetings, everything. So that's been how we roll over here, and how we take cope with the COVID. Thank you.